Good afternoon. I am Athena, the CEO and co-founder of ZumVet, a veterinary platform for animals. Next slide. Today, I'm here to talk about a different type of patient, companion animals. Many of you here probably already are a proud parent of a dog or a cat. And in fact, companion animals are one of the fastest growing populations in the world. Hastened by COVID, we saw the number of new pets reach record highs, especially here in Asia. In fact, many countries are moving in the direction of having more pets than children, and we see this becoming a lasting trend. However, the veterinary industry hasn't caught up. Next slide. Despite an unprecedented demand for pet care around the world, there continues to be a shortage of vets and limited access to treatment. This roughly translates into an average wait time of about 2 weeks to see a vet, and a potential wait time of 6 weeks to access treatments like vaccinations during certain periods. And as a result, a majority of pet owners are turning to online channels for unqualified advice and self-medicating their pets for seemingly mild conditions. But what we found is that this human intuition doesn't always translate well for animals, and good intentions can often lead to adverse effects. The current veterinary infrastructure, one riddled with regulatory restrictions and traditional processes, drives a deep chasm between expectation and delivery and perpetuates the mistrust between pet owners and providers. Next slide. But what most pet owners don't understand when getting their first pet is really how difficult it is to get help when their fur baby falls sick. Dogs and cats are unable to speak and may exhibit symptoms in ways that are often mystifying for their pet owners. More than 80% of them will end up relying on an online resource as their first line of defense, and many of them won't immediately consider seeing a vet until conditions worsen. And just like human healthcare, this delay will cause conditions to deteriorate rather quickly and increase the eventual bill size. Yet, unlike human healthcare, little Bobby here will also need to take a fairly active role in managing a stressed animal and ensuring compliance to advice after a consult without much support. This is why pet owners often avoid vet visits and often take a wait-and-see approach. Next slide. Now, there are three main reasons why veterinary care is falling behind. The primary and most problematic one being that there is a shortage of vets. Most people become vets out of passion for animals, but soon find that it's an intensely stressful career with limited resources and career progression. We're seeing an annual attrition rate of about 10% globally, mainly due to burnout, and our pets are suffering as a result of this. Veterinary practices need a new paradigm, one that offers a stronger support network to its frontline workers. Yet the ecosystem is dominated by traditional players who have little impetus to change their existing practices. But with a new type of pet owner emerging, one who sees their fur babies as a core part of their family unit, the need for a more patient-centric approach is now essential. Next slide. We created ZumVet with the intention of developing a two-sided ecosystem that caters to the need of both pet owners and vets. Our core values are extreme efficiency, always-on care, and constant innovation. We believe that access to care should be simple, and we aim to provide pet owners with the tools necessary to ensure that they're empowered to make the best decision possible for their pets. Our service offering includes telemedicine, point-of-care diagnostics, and an e-pharmacy. We also understand that vets need an equal measure of care, and what we offer is a way for vets to practice on their own time with the full backing of a full ZumVet platform, one which includes an EHR, pharmacy, as well as around-the-clock access to a dedicated support team so that they too can focus on what they do best, which is caring for our pet patients. Next slide. With over 500,000 data points on medical outcomes, what we found is that 70% of cases that enter a clinic are for rather minor conditions, such as chronic skin issues, gastro-related issues like diarrhea or vomiting, and minor infections. Typically, a full consultation would involve diagnostics and a full suite of traditional treatments being dispensed. This not only puts a great burden on the pet owner, but also adds to the already full plate of clinics. We found that with common conditions, if we knew key parameters such as age, weight, breed, and certain environmental factors, we could actually predict causes and automate the recommendation of treatments. For a pet owner, this process would take about 15 minutes to complete, dramatically reducing the effort on their part. And for a clinic, They can benefit by having continued oversight on their patients without having to tap into clinic resources. So by reducing upfront costs, we have observed our users re-engaging our services more often, thereby increasing average vet visits from 1.5 times every 2 years to 4 times every year. Next slide. Our predictive workflow relies heavily on diagnostics to ensure the accuracy of diagnosis. For common pathogens and conditions, ZumVet has assembled 5 clinical-grade rapid test kits that allow pet owners to administer themselves at home, thereby reducing the cost and time needed for a pet patient to receive the care it needs. Our solution enables routine testing and early detection of serious diseases so that pet owners don't only discover illnesses when it's too late. Through the availability of rapid testing, vets can safely turn to remote care and telemedicine as a viable means to care for their pet patients. And by 2023, we're aiming to double the number of rapid test kits that will be available to our users. Next slide. Most pet owners in this audience will probably already know that your fur babies only care about a few things in life: good food, good sleep, and good play. And that's why palatability is very important and plays a very big role in pet nutrition. If something doesn't taste good, the reality is that your dog or cat will eat it. And too often, we hear a lot of our pet owners tell us and complain about how they have a very difficult time administering medication to their pets. And that's why we've incorporated a centralized compounding function to our e-pharmacy to ensure that pet owners don't have to worry about rejecting their medications anymore. And this has vastly improved the compliance of pet medications, and also will encourage pet owners to come back and get medication refills. Next slide, please. Sorry, one slide after. So all in all, we have seen a huge impact in how pet owners engage in veterinary care with the access to telemedicine. So what we've seen is that previously, most pet owners were seeing their vets about 1.5 times every 2 years. This has gone up to 4 visits per year. And not only that, typically it takes about 2 to 3 hours for a pet owner to bring their pet to a clinic and return home. And with our platform, our pet owners can connect with a vet within 15 minutes and complete their consults within 30 minutes. And we're able to also reduce the time to treatment. So in fact, in most cases, whether it's oral medications or diagnostics, we're able to deliver that to a patient's home same day. And most important of all, the barrier to entry for a lot of pet owners is the cost of treatment. Through our platform and in the way that we've been the way that we have created our dispensary, we're also helping our pet owners reduce costs and save up to $480 per year. Next slide, please. It is without a doubt that a physical touch point will always be integral to healthcare. And in order to tackle this growing supply chain issues and vet shortages, we believe that an omni-channel approach will be the most ideal way of ensuring access to care for all animals. And within the next 3 years, we envision that ZumVet will deliver veterinary care seamlessly online, serving pet patients right from the comfort of their own home. Next slide. Thank you for your time today, and feel free to contact me. My name is Athena Lee. I'm based in Singapore, so please do reach out if you have any questions about veterinary care. Thank you.